Hello, this is Dr. Gabriele Gross, and welcome to another webinar in our series, Innovations in Equine Health Management. Today, we would address horse health issues after relocating, which is really more than that, whether your horse has been in the same place in a long time or it has been moved. The question is really what lies beneath your horse's health. And to start, this presentation is for educational purposes only. It is not intended to replace or represent the practice of veterinary medicine. This content presented here is the opinion of myself and my field study findings, which have not been approved by the FDA, any regulatory veterinary boards, or the pharmaceutical industry. I got my veterinary degree in 1987 in Germany and a PhD in pharmaceutical sciences in 1989. In Germany, the veterinarians have several years of nutritional education. I focused on equine nutrition. My expertise globally extends to equine performance, nutrition, and herbalism. You can reach me on my website, horsehealthcoach.com, or comment here in the comment box. You can reach me by phone at my office at 425-465-0407. My mission is to create nutritional custom programs for individual horses. I also give classes and seminars in select locations. What we're addressing here today is a root cause issue that leads to a variety of horse ailments. Veterinary treatment addresses usually one symptom and has one particular remedy or medication for that symptom. It does not address the underlying development of the symptom and what produced it originally. Today, we want to address a few of these root causes. This root cause here discussed lies in mineral imbalances in the soil, which are very location specific. What actually happens here? And let's go straight to the root cause. If your horse eats hay from an acidic soil, hay that was produced on a soil that is low in pH, lower than 6.5, the lower the acidity is, or the lower the pH is, the higher the acidity, the worse the problem gets. There will be a mineral imbalance in the grass or hay that your horse eats. And this mineral imbalance develops over months because the metabolism for minerals is rather slow. And it can manifest in ligament and tendon injuries, in joint problems, in anemia, lethargic horses, fecal water ulcers, and other issues. Let me show you a few case studies. Here's a case from South Carolina. On the left, April 2024, on the right, June 2024. So you can see there's only a couple of months in between. And you can notice the difference in color and coat quality on this horse. Also, the significant weight loss and metabolic change this horse, this pony, has gone through. This happened because we balanced the minerals that this horse ate. Another case from June 2013 shows you that this issue has not just recently come up. It has been existing for at least a decade or more or longer. On the left, the horse is appearing commonly called bleached. There is no such thing. Horses do not bleach from the sun. They might have local mineral deficiencies, what makes their coat appear lighter in color. On the right, the same horse, a couple months later, with the right mineral balance in the diet. This is the same horse. You can see how he has muscled up and looks completely different, aside from the obvious color change in the coat. Another example here, thoroughbred mare in California. On the left, before mineral balance. On the right, a couple of months after. This is a case on the East Coast. This horse had skin issues that would not respond to veterinary treatment. The blue areas are the blue spray, disinfectant spray. Here on the head, very severe. On the flanks, the hip bones. And here is how this horse looks 60 days later after we balanced those minerals. Also, the injuries on the head are completely healed after we balanced the iron, copper, and zinc ratio nutritionally. Another case, here's an Icelandic pony, also in South Carolina in December of 2023 on the left, and in May 2024 on the right. You can notice the obvious change in color. A case from Kentucky, February 2024 on the left, and a couple of months later in May of 2024 on the right. Notice the color change and the overall change of physique in this horse. Muscle building, she's more toned, right? Seems more alert, as far as we can tell from a photo. So what is going on here? Here is a map published by the Department of Agriculture in the year of 2010. Now, this is about a decade and a half prior to this recording. And unfortunately, from my experience, it is not as black and white or black, gray, and green as it seems here. The color changes or the differences in pH consistency or pH of the soil in the different states is much more difficult. If you zoom in, for instance, now to California, you can find that most of the state of California is actually in a rather acidic state, or the horses that are on the grounds here are also very mineral imbalanced. And the mineral imbalance comes from the nutrition or the soil they are on. I found this out with comparing soil analysis with hair analysis with what we call tissue mineral analysis, and they are directly proportional. If your horse grazes on acidic soil or eats hay from acidic soil, your horse will show a certain mineral deficiency we're going to talk about here in a moment. You can see predominantly all of the eastern states are in a very low pH, which means it produces an iron overload and a copper deficiency. Here's what happens. So you see in the blue bar on top, you see strongly acidic means a pH. This is an expression for the acidity of a substance. pH very lower 4 to 5.0. And at that pH, really none of the essential minerals that your horse needs to be healthy get absorbed from the soil into the grass or into the hay, except one. And this is iron. So when commonly, when there's for instance, an anemia diagnosed, which stands for the lack of red blood cells in your horse, the cause or the root cause is non-visible in the blood test itself. You see the symptom, you see the sign of a red blood cell count, but there are actually several causes for an anemia. The most frequent cause to be believed is an iron deficiency, but that is actually not true for the areas that have this low soil pH. In those cases, it is rather a copper deficiency because it takes 3 different minerals to make red blood cells. It takes copper, iron, and a mineral that is not listed on this list here, which is cobalt. Cobalt gets processed in your horse's hindgut by the probiotics and plays a role in vitamin B12, which helps to make cobalamin and is integrated into the red blood cell formation. the point I'm trying to make here is that if your horse grazes on a pasture that is not pH balanced, which means does not have a pH somewhere between 6.5 or 7, or your horse's hay is grown on a pasture that is not balanced and is grown on an acidic soil, your horse will eat hay that is most likely in iron overload. So if you research iron overload on the internet, you might come across reports that say that iron overload produces endocrine and metabolic disturbances, and I have found the same in my nutritional practice. Here's a specific example of a soil analysis. This is how they look like or can look like depending on the laboratory you use and the area you're in. The most important point here is, I'm sorry for this data-intensive image, I've extracted the most relevant data here, the pH at 5.7. So this is already slightly acidic. If you think that 7 is neutral, there is an iron count of 45, whatever the unit is, and copper of 0.3. Now I want you to watch carefully when I pull up the next slide. So keep in mind 5.7 and 45. What happens now if I go further down towards the acidity from 5.7 lower? What happens to the iron? So it's 5.7 and 45. And now we're going to go to another point on the same property, actually, to another pasture. Now the pH goes further down to 4.8, and look what happens to the iron. Look how that skyrockets. And yes, the copper went up slightly, but the difference here, the discrepancy between the iron overload and the copper is enormous. And this leads to these bleached-looking horses and the hoof problems and the white line disease and anemia and lethargic appearance and inability to perform, because copper is so very essential to all of that. If you were to take a hair analysis, which is precisely also called tissue mineral analysis, from a horse like this, you will find that analyzing a little bit of mane hair, you will see in this horse's body cell an iron overload and a relative copper deficiency. Minerals are antagonistic to each other, and copper and iron, they're antagonistic. So if one mineral is high, it pushes, so to say in simple terms, the other mineral out of the body. And this mineral is very, very important for to build red blood cells. In the balance, they both are, right? So this horse is most likely anemic. This horse might show white line disease because we need copper for the integrity of hoof substance. This horse might be lethargic because he doesn't or she doesn't get enough oxygen to perform and might be breathing heavily, which raises the impression of maybe a lung infection or a heart problem. So it will guide you and the veterinarians completely down the wrong path if nobody looks at these minerals. And these minerals are, as I might have mentioned earlier, not accurately reflected in a blood analysis. In the blood, you only see the results of these mineral imbalances, not the mineral deficiencies themselves. Here's another case, a so-called bleached-looking horse. Again, horses do not get bleached. They have a mineral deficiency, and this is most likely here copper. Sometimes zinc plays a role too, especially if the wounds are not healing. Zinc is important for skin health and wound healing. I'm sorry for this overloaded chart. This is an overview of all the things that can happen if your horse grazes on an acidic soil or eats hay from the soil that is acidic, produced on an acidic soil. Because of the large amounts of hay or pasture grass your horse consumes, this is the most frequent and most common reason for this condition in your horse. iron overload has been related to endocrine problems and insulin resistance, but it does much more than that by driving the essential element of copper out of the body. And signs for your horse having a copper deficiency are that your horse is constantly hungry, no matter how much hay you throw. And now imagine, if your hay is in fact an iron overload, the more hay you throw, the hungrier your horse gets, because they're craving, proportional to the excess iron they're taking in more and more, they're craving more and more copper. So the more you feed your horse, the hungrier they get, which doesn't make any sense. You think your horse doesn't get enough hay and you're feeding them more, now they are also obese. So instead of feeding more calories and more hay, you need to look at what is going on here. Anemia, as we discussed, anemia can have 3 different reasons. In the mineral realm of things, it could be a copper deficiency, it could be an iron deficiency, or it could be too much iron and a related copper deficiency, or it could be a deficiency of cobalt, or maybe a combination of all of them. The best way to do here is take the hair and have it analyzed for minerals. Iron overload can lead to metabolic issues, to overweight horses, also overweight because they're craving food constantly all the time. Copper, in turn, is important for collagen tissue and ligament integrity. So a lot of these suspensory injuries are really due to an underlying copper deficiency. Joint problems, the same. Joint problems, joints have cartilage, and cartilage needs copper. There's a study that has found that foals are born with cartilage problems and osteochondrosis dissecans if they don't have enough copper in their system, if the mare does not take enough copper in, right? Hoof problems, same thing, white line disease, frequent thrush, no heel growth is the effect of a low copper or copper deficiency with iron overload, coat problems, as you have seen. And also, ultimately, your horse will get stressed out because of this underlying mineral imbalance. So the endocrine system gets dragged down, the thyroid goes down, and the horse feels relatively cold. The thyroid is in charge of everything that has to do with speed, heat, and intensity in your horse's body and in your own body, of course, as well. So when the thyroid reacts with the euthyroid syndrome, which is related to the thyroid responding to another root cause in the body, then we have secondary signs and symptoms, and then they get diagnosed and treated, but you never get to the bottom of things, right? To the tip of the iceberg underwater. Performance issues can be because your horse is anemic. Fecal water can occur because now your horse has an ulcer, or there's imbalance in the hindgut because your probiotics are not getting taken care of. All of this plays a role, and everything is connected in the body with each other. Skin problems, if you have seen, that you have seen in the pictures before, and then respiratory issues and all these kind of different things. This list might not even be complete of all the things I've seen in horses that have a mineral imbalance. Very important, I'm just picking out one example here. Again, anemia. This can be produced by lack of iron, lack of copper, or lack of cobalt. Iron, copper, and cobalt are essential minerals, and you cannot see them reliably in a blood test. What you will see is that there is less red blood cells, which is called anemia. Lack of red blood cells lower than normal, but you cannot see the cause for that, right? Now, there are other causes for anemia that need to be excluded, but as for minerals, these are common causes, and most likely, if your veterinarian sees an anemia in the blood and has ruled out other causes such as intense bleeding from an emergency or heavy parasite infestation or something like this, they will most likely recommend to you a supplement that will mainly contain of iron. Now, if your horse has an iron-related anemia, your horse will respond well. But if your horse actually has too much iron and has a copper-deficient anemia, you are making the anemia worse by feeding even more iron. And lack of cobalt is another story, so that requires, again, mineral testing in the tissue, in the hair itself. And again, none of these deficiencies show reliably in the blood test. You just see the effect of this root cause mineral deficiency. Here's another example of white line disease. Looks terrible, right? This horse has been chronically copper deficient. Well, it's allergies. You drag the whole immune system down with the mineral imbalance because the body tries to constantly compensate, and it's costing the adrenals and the whole endocrine system energy, and ultimately the system will collapse and your horse will be more sensitive to all kinds of things. Fecal water could be related to mineral deficiencies or loose manure. And of course, your horse will get stressed because let's just say your horse has anemia and cannot breathe properly. And you're asking this horse to do things that would require more oxygen. Maybe piaffe passage, jump 6 feet or whatever. Your horse cannot do this. And then also after, your horse will get extremely muscle sore because the lactic acid that accumulates is related to an anaerobic situation in the muscle. That means the less oxygen is available, the more lactic acid will be produced in the muscle, and the more muscle sore your horse will get, and the more tense and cold-backed your horse will get, and it drags it down into a downward spiral. So better to eliminate those root causes and make sure that you can ultimately work your way upwards from the root cause. Of course, if your horse has any symptoms, please, you will need your veterinarian to address those symptoms. And at the same time, you can start asking yourself, how can I address the root cause and how can I rebalance my horse's health from the ground up? Another sign that I often see, skin is very thin and almost appears like translucent because the hair is somewhat sparingly and the color is odd. This even looks like a scar. You could say, oh, I swear this is an old scar. Well, it actually isn't. It looks very strange, but it filled in after we supplemented with enough copper. Now, important here to say is that the national requirements published do not factor in the local deficiencies. So let's just say if the national requirements are somewhere under 100 milligram per day per horse, this will not be enough for your area. And that depends on how copper deficient and how much an iron overload your specific area is. And again, to know this exactly, you need to test your minerals in your horse first to then adjust, customize, and adjust the particular need and amounts of copper that your horse will need, right? Welts, allergies, allergic reactions can happen. You see even a lymphatic reaction along the belly. This happens sometimes from an effort of the body to detox from the excess toxic minerals, and to the point that they get what we call a Herxheimer reaction. This can be looking very intense, but it's usually can be addressed with some detox and stuff like that we're going to discuss another time. Now, your take-home message is, my advice to you is wherever you are, if you have pastures, you should test them for pH and minerals. Agricultural experts or colleges in your area can do that. And then if your pasture pH comes out to be acidic, you can have them lime. It's commonly called liming a pasture, adjust the pH. And respective minerals, I would test iron, copper, selenium, zinc, maybe cobalt, and then adjust those minerals. But that takes time, and sometimes there is a best time to actually balance your soil. The agricultural experts know this much better than I do. I just know it needs to be done. And in the meantime, especially if you have issues with your horse, check the minerals within your horse. You can choose a hair analysis laboratory of your choice, but I would highly recommend that you choose an expert with it that will interpret the results properly and will connect you to the right feeding program. As always, you can ask me, and thank you for listening today.